So for now, we're going to do a little bit of intro for some of the things that AmeriLife Marketing Group does and we're preparing to do for Medicare Advantage season. We've got some certifications being released for the AHIP certification on June the 18th, which is Monday. So this webinar is set up to be sort of the precursor for the to prepare you as either a refresher because you did it last year and you're kind of familiar, or maybe it's a brand new thing for you and this is kind of valuable information to kind of get you through that initial phase of understanding Medicare. We're also going to just share with you that AmeriLife Marketing Group has an AHIP reimbursement program. If you don't know it already, the AHIP certification costs $175. And so AmeriLife Marketing Group is going to kick in and do a reimbursement program for you. So eventually, after you've written a couple of pieces of business, you're going to get all of your money back for the money you spend on AHIP. But to begin with, we have a discount program for how we buy the AHIP certification. So instead of it costing you $175 through us, we're going to be able to offer you a price of $125. So that's going to take $50 off of the price. But once you've produced, I think it's 5 pieces of business, all you need to do is just let us know when you've hit that 5 pieces of business, and we're going to reimburse the entire $125 that you've spent up front to get certified. So that's a nice little bonus for you to be able to get that reimbursement. At the end of the webinar, we're going to share with you our lead giveaway. So throughout the webinar, we're going to be asking questions in our polls that when you answer them will help to qualify you for the giveaway. So 10 of the agents on this webinar are going to get 10 exclusive leads apiece. And so we'll tell you more about that at the end of the webinar. We've got another great offer that our vendor and good friend of mine, Todd Justin, is going to share with you guys. He's going to tell you a little bit more about that at the end of the webinar, so stick around for that. Also, the poll participation is how we're going to score the people that get the free leads. And so be sure to answer all the questions just as quickly as you can as they pop up on the screen, and that'll help to qualify you to be eligible to receive those free leads. Also, we've got a direct mail program that we offer through the agency. This is something you'll want to talk to your marketer about. It's basically comes down to our way of rewarding you for honoring us with your business. And so if you've written 10 pieces of business throughout the last 12 months, you would have qualified for a 1,000 piece mailer. Totally 100% of the costs related to that mailer are free for you. So we're going to pay 100% of the costs. Also, we have a brand new pharmacy program that the details are being solidified right now in our offices, and we've got a number of different pharmacies throughout the United States that we will be looking for agents to fill those spots. Very interesting program. The details will be forthcoming. If you are not associated to me on the LinkedIn, again, my name is David Paul. I'm your presenter today. Stop what you're doing at the end of this webinar and link in with me. That way, when we do release the full details, you'll get them first. It will be a first come, first serve type of program. So if we release a pharmacy in, let's say, Charlotte, North Carolina, chances are we do business with a ton of agents in Charlotte. So the first agent to respond is going to have that opportunity. So be sure to be linked in with my LinkedIn profile so you can be the first to know about it. So with that being said, I'd like to introduce to you a very special guest. His name is James Stankiewicz. He is our corporate trainer for the AmeriLife career side. And he does this presentation very often for our new agents. And so we felt very confident to bring him in to share with you the nuances of what Medicare is. And that way you'll feel more confident with not only sharing the information with your clients, but hopefully it'll extend itself as valuable information while taking the AHIP certification this year. So why don't I turn it over to James and let him get on with the meeting.
Well, good afternoon, everyone. Good afternoon, David. Glad to be a part of this again. Medicare, going to try to make it as plain and simple as we possibly can. Many of you may be involved in the marketplace, and we're going to look at it maybe not so much from your perspective, but from the perspective of the individuals that you're trying to assist out there in the community. There's a lot of information. There's a lot of resources out there. And naturally, you want to be that ultimate resource that everybody goes to and that everybody refers other individuals to. So we're just going to break down Medicare, make it as simple as we can, but we're going to look at it from the prospect's position. What are they really concerned about? So just as a brief overview, what is Medicare? It's nothing more than just a health insurance program. It's health insurance. Bottom line, that's what it is. When we mention companies like Blue Cross Blue Shield, Humana, United Healthcare, we think of health insurance companies. Medicare is nothing more than a health insurance company, albeit a very large one. Now, the intended audience, a little bit different. Majority of them are 65 years of age or older that are on the program. And you could be under the age of 65 and be on the Medicare program, but you got to meet certain requirements. You got to be disabled. And so from that standpoint, when we look at what's going on out there in the marketplace, we probably have pretty close to about 58 to 59 million individuals that are currently on the Medicare program right now. So therefore, we have a lot of opportunities to engage a conversation with individuals. And you probably heard statistics that about 10 to 11,000 people every single day in the United States is turning 65. When those individuals age into the Medicare program, they have a lot of questions, and therefore they're looking for resources. Now, some of those resources could be online, Medicare.gov, a great resource. It comes in the form of a booklet. There may be some pamphlets. There may be solicitation from insurance companies. But a lot of the information that is being shared out there tends to confuse people more than clarify individuals. So we want to be able to assist those people the best we possibly can. Well, where are we going to go to in order to determine who really runs the Medicare program? You know, with that being said, Centers for Medicare and Medicaid Services, they're the ones that administer it. Social Security Administration enrolls most of the individuals that are in that program. Now, how can people enroll into the program? Essentially, there's three different ways in which they could do it. They can do it online through Medicare.gov if they choose to do so. They could go to the Social Security Administration, do it in person, or they can pick up the telephone and they can call Medicare or 1-800-Medicare, I should say, and they'll get them direction as to how they can complete that enrollment process over the phone. Now, when the person is eligible for Medicare, they have at least two choices that are available to them, and it has to do with their understanding of the parts of Medicare. So as you can see here, we got four parts: Part A, B, C, and D. That's what we have. Now, when an individual enrolls in the Medicare program, they're going to receive their kit. And when they receive their enrollment packet back from the federal government, they got some choices. And so this next slide here, hopefully it will help to simplify that process as to what the consumer has in front of them. They're going to start off with what's on the left side of our screen here. So the government is going to automatically enroll them into Medicare Part A. And even though Medicare Part B is an optional program, the federal government will assume that the individual wants to be opted into Medicare Part B. We're going to break both of these parts down in greater detail here in just the next few minutes. Now, when an individual analyzes what's going on with their Part A insurance, what's going on with their Part B insurance, they may understand what it covers, but what they're concerned about is how much is it going to cost them in order to receive services. Well, they're going to find out that the out-of-pocket exposure could be extensive, and therefore an individual has options. So they can either enroll into a Medicare supplemental plan if they choose to do so, and they can also get a prescription drug plan.
So that's kind of where the agent comes in, and the value of the agent becomes the counselor to, I guess, maybe evaluate what those costs might be and how they might look at those costs related to maybe their income or whatever, monthly expenses they might incur.
Oh, without question. Yeah, and unfortunately, the range of options that are available to an individual could be overwhelming to them. And they many times don't know really what to do. So therefore, once again, it comes back to the resources. Where are they going to find information that will help them make decisions? Experience indicates that all too often they go to their friends who live down the street for direction. And sometimes that's not always the best course of wisdom for an individual.
Well, they may have a completely different situation in their house so what their advice might be could be actually the wrong stuff.
It very well could be. So when we look at this on the right-hand side of the ledger, it's just a different option, a different way in which somebody could receive their health care benefits. This is under the Medicare Advantage Plan, also called Part C. Now, from the government standpoint, it's still going to combine the benefits that are available under Part A and Part B. And sometimes these Medicare Advantage plans, Part C plans, they include a prescription drug plan in them as well. So let's talk a little bit about how somebody gets enrolled into these programs.
Tell you what, before we go too much further, let's go ahead and run our first poll question, guys. So this is, again, part of how we qualify for the leads at the end. So let's do this. Let's go ahead and run the first poll. So on your screen now is the question. It says, why is the senior Medicare market a great business for agents? So jump in on that one and answer very quickly so we can get back to our questions or back to our presentation. Looks like everybody's jumping in on the right answer. It seems pretty obvious and kind of more of a freebie question for you. Get in there and answer the questions now because we're going to cut off the poll here in just a second. You want to make sure you're eligible for the leads at the end, so be sure to answer that easy question. So we're back in our presentation, and James, why don't you take it back over?
All right, very good. For most individuals that are aging into the Medicare marketplace, their enrollment in Medicare is going to be pretty much automated. As I already indicated, they're going to receive their enrollment package, usually mailed to them 3 months before they turn 65 or within the 25th month of their disability, if that's how they qualify for the Medicare program. Now, this year, they're going to be receiving a new identification card. The old cards that Medicare sent out usually included a Social Security number on it. And so now the government wants to, due to privacy, they want to make sure that nobody has a Social Security number out there. So that serves as a good excuse to get in front of people.
Well, that may actually let's go ahead and jump into the next question, which may have actually been answered already. James is looking at me like,
I didn't know this question was going to be asked.
But yeah, you jump in and get that answer quickly so that we can get back into the presentation. I was unaware that James was going to be so thorough and current with his information. We may have another couple of questions pop into this category, but who knows? But if you get in there and answer the question real quick, we'll go right on to the next, continue with the presentation. Come on, you guys. Only 58% voted, so get in there and get it in now. All right, we're going to go ahead and close that poll and jump right back into the presentation.
All right, well, now that I blew that question for everybody, we'll get back to the business at hand here. When can an individual enroll into the Medicare program? Well, here's the 7-month window. This is going to be important for you folks to know that, especially if you're dealing with individuals that are about to turn age 65 and qualify for Medicare. They may be asking you when they can do so. And now you have the formula that will allow you to give them direction in connection with when they can enroll into that program. Pretty simple and straightforward. Generally, the month in which they turn 65 is the starting point as far as how you calculate the formula. Here's one exception, however. If their birthday falls on the first of the month in which they turn 65, their month of eligibility really turns out to be the month before their birth month. So it could be a little bit confusing, but you want to set yourself apart from your competition and really demonstrate you know your business. So that's one thing you could alert them. So for example, here we are in the month of June. If somebody's birthday was June the 1st, their month of eligibility really began in May. So 3 months before May, which would put us into February, March, April, the month of May, and then June, July, and August would be their 7-month window.
I promise you there's a large percentage of the agents in the marketplace that do not know that.
Yeah. And so there you have it. So you kind of set yourself apart from your competition. Now, when a person enrolls, they're going to get their welcome package. They're going to have some questions. They're going to want to understand what's going on with at least Medicare Part A. Now, most people don't pay a premium for Part A, and that's if they paid enough taxes into the system. So there we have the rules that govern that. 10 years or 40 quarters, doesn't have to be consecutive. Now, if they don't enroll in Medicare when they're first eligible for doing so, they delay their enrollment into Medicare, they may be subject to a premium penalty. My experience in the industry, I have yet to really see that affected with Medicare Part A, but just keep that in mind. You may run across some people that may be paying, and generally when you think they shouldn't be, and that's because they're being penalized in connection with that. Now, when it comes to what a person's going to pay when they go to use their Medicare Part A, now Medicare Part A is really designed to cover 5 distinctive areas. We're just going to focus in on 3 of the distinctive areas. This is where most people are going to tend to use their Medicare Part A benefit for the most part. For hospitalization, they may need some skilled nursing facility care, and they may need some home health care. When the individual goes to use their Medicare Part A, say they suffer a medical situation that requires them to be hospitalized, there is some cost associated with going into the hospital. So Medicare Part A we can basically refer to as this being the cost to cover room and board in, we'll say, that Four Seasons hospital. So for example, let's say Mr. and or Mrs. Jones, they fall down, they break a hip, they end up being rushed off to the hospital. Depending on how long they're in the hospital will determine how much they're going to have to pay. So the first 60 days in a hospital, Medicare calls this the Part A deductible. And the Part A deductible for this year is $1,340, as you can see there. Now, this is where the confusion for the consumer comes into play, the terminology that Medicare uses. Medicare calls that $1,340 the Part A deductible. Now, in of itself, you may not think it's an issue, but most people are familiar with deductibles, but they generally associate a particular time frame in which to satisfy those deductibles. Most people, 1 year. Well, this is not an annual deductible. This is a per benefit period deductible. And
when you think of deductible, especially in the underage marketplace, which is where they came out of, they might be working, or have worked in their life and think of their deductible as a calendar year deductible.
Yeah.
So it's definitely worthy of taking the moment to sort of impart the knowledge and share that with them.
Yeah, we'll get to more of a definition as to how we can determine what a benefit period is. But just to kind of give you some insight, they could pay this $1,340 more than one time during the course of a calendar year. Now, if they have some conditions that require them to be in the hospital beyond 60 days, then it's going to turn into a co-insurance or a co-payment. So from day 61 through day 90, they're going to have to come up with $335 per day, and then Medicare will take care of the balance. If somebody finds themselves in the hospital beyond 90 days, a rare occurrence, but it does happen, then the daily co-payment is going to increase to $670 per day, and then Medicare will take care of the balance. These 60 days, day 91 through 150, Medicare calls those lifetime reserve days. Basically what that means is an individual only gets to access those days and utilize those days once during their lifetime. We use the expression benefit period. So if somebody's going to experience a benefit period, and once they're released from the hospital, Medicare says that their benefit period will reset or restore. So if we look at this hospital inpatient stay section of this slide, and you look at that first section there, days 1 through 60, we'll call that phase 1 of their hospitalization. Day 61 through day 90, we'll call that phase 2 of their hospitalization. And then the $670 per lifetime reserve day is really from day 91 through day 150. We'll call that phase 3 of the inpatient hospitalization. When a person comes out and their benefits reset, whatever days they used in phase 1 will be restored. Whatever days they used in phase 2 would be restored, but whatever they used in phase 3 will never be restored to them. So hence they only get to use it once during their lifetime.
Stuff is starting to add up, isn't it, James?
Oh, it can be rather costly.
Yep.
Now, the second portion is in regards to skilled nursing facility care. This is perhaps the most misunderstood aspect associated with the Medicare program. When people hear the expression skilled nursing facility care, they're thinking of nursing home. And everybody has, I shouldn't say everybody, but most individuals have some experience where they know of someone who has been in the nursing home, and many of those individuals have been there for a prolonged period of time. Now, Medicare says that they will cover services rendered in a skilled nursing facility, but it's capped at 100 days. So for the first 20 days, the individual that's in that skilled nursing facility doesn't have to pay anything. However, from day 21 through day 100, as you can see, the cost is $167 per day, and then Medicare will take care of everything above and beyond that figure. Should the individual be in that skilled nursing facility beyond 100 days, Medicare basically says, we're done. We're not going to cover any more of the cost. It's all on you. Now, this is a rude awakening for many because, as mentioned, it's a misunderstood aspect of the program. People think that Medicare is going to pay for an unlimited amount of days in a nursing home, but that's not the case. And when you explain that to people, sometimes they take a defensive posture and they give you an example or an experience of someone they know that has been in the hospital for several years, and they claim that Medicare has paid every single penny of that stay. Well, they are right. Somebody's paid it, but it hasn't been Medicare. It's the other program that sounds very familiar, Medicaid. So they're two different programs altogether. But this is what Medicare is going to do, is cover you in the event you need skilled nursing facility, but only up to 100 days. Now, there's a caveat to gaining access to that benefit. There's a number of requirements. The big one is you have to have been in the hospital prior to entering into the skilled nursing facility. You had to be there for at least 3 days, and the day of a discharge from a hospital does not count as the day. The condition has to be rehabilitative. You got to be improving. Reason why you're in that skilled nursing facility is the same reason why you're in the hospital. So there's a number of different requirements that need to be met before Medicare says, hey, we'll cover it. The biggest one, though, is people don't understand that there's various levels of care that are administered in nursing facilities. Essentially, there's two levels of care, skilled and intermediate, or sometimes referred to as custodial. Medicare will only pay for one level of care, and it's in their name, skilled. So skilled nursing facility care will only cover skilled care services. Those services rendered by an RN, an LPN, a speech, physical, occupational therapist, individuals along those lines. The moment that the care falls to a custodial level of caregiver, Medicare says we're not going to cover it, even though an individual may need assistance performing activities of daily living 24 hours a day, 7 days a week. If it does not require a skilled care practitioner, Medicare says we don't cover it. That's why this particular benefit of Medicare is so confusing to many out there. Now, sometimes people would like to receive their, we'll call it rehab services outside of the skilled nursing facility, and they can receive it at home. And so that's where Medicare would like people to receive care anyways. Get better care. People tend to improve a lot quicker there. And so there's no cost for the services that are provided in that setting. Now, if somebody needs durable medical equipment, well, then there's going to be some cost sharing that's going to take place as far as that's concerned. Now, as indicated a little bit earlier, benefit periods. This is where it gets to be a little dicey, a little bit confusing to a lot of individuals, is how do we determine how long a benefit period is? I really like to focus in how do we know when it ends? And if you look at that third bullet point down, it's when an individual has been released from the hospital or the skilled nursing facility for 60 days in a row. So they're released from the hospital. Once 60 days have elapsed without them having to go back into the hospital, then the benefit period has just been completed. Therefore, if they find themselves going back into the hospital at a future date, they would therefore have to satisfy another Part A deductible, because that's a new benefit period that they're going to experience. And as you look at the bottom there, no limit to the number of benefit periods some person can have. But if we really look at a calendar, and if everything lined up correctly, an individual could experience as many as 6 benefit periods in a calendar year. Could be rather expensive. So that gives you a decent idea as to what's going on with Medicare Part A and how most people feel about that. Well, let's take a few minutes to dive into the Medicare Part B program.
Well, before we do that, let's go ahead and share the another poll and see if we can get some more answers. All right, launch the poll. All right, what other coverage should a senior consider? Prescription drug coverage, final expense, hospital indemnity, cancer insurance, or all of the above? Wow, everybody's jumping out of the gate. Looks like everybody's getting this one right. Should be pretty easy, though. So we'll go ahead and close this poll now. Get your last minute answers in real quick, and then we'll jump right back into our presentation.
All right, Medicare Part B. This is an optional benefit, but most individuals, they choose to opt into the program, and for good reason. It really is where most people tend to use their healthcare benefits most often, using it to go see the doctor for the lab work, the x-rays, so on and so forth. So, pretty simple and straightforward as far as that is concerned. Now, unlike Medicare Part A, which is premium free, Medicare Part B does have a premium that is associated with it. Now, most individuals are going to be paying a standard premium, but based upon income, it could increase. And so here we got the chart that kind of gives us an idea as to what an individual possibly could be paying for their Medicare Part B. As mentioned, most people are probably going to be paying that $134 a month. Now, the way in which individuals pay that, generally deducted from their Social Security checks. So it's pretty simple, pretty straightforward for individuals. If you look at the bottom, though, it says that an individual may have to pay more if they have a Part B late enrollment. And so from that standpoint, some individuals, when they're first eligible for Medicare, they decide to make a choice that they don't want Part B to start. Now, that's their prerogative. An individual doesn't have to take Part B if they don't want it. And if they change their mind a little bit later on down the road, Medicare says, hey, we'll take you back, but there's going to be some consequence. So part of the consequence is a premium penalty. That premium penalty is going to be 10% per year that they delayed their enrollment to Part B when they were first eligible for it. So let's take a look at a real-world example. Mr. Jones turned 65 7 years ago. Got his welcome to Medicare package in the mail, made a decision. He didn't want Medicare Part B. He opted out, and he had nothing else that was going on along with it. 7 years later, he developed some health problems. He realizes that there's benefits of being enrolled in Medicare Part B. Now he wants it. Well, the government will allow him to get enrolled into the program, but because it's been 7 years that he didn't have anything else in place, it's going to be 10% per year. So that equals 70%. Well, whatever 70% of $134 is what's going to be added to his monthly premium, and he's required to pay that for as long as he's alive. So the consequences associated with not enrolling into the program when you're first eligible. Now, when an individual is enrolled and they go to use their program, How's it broken down for them? Well, under Part B, there's basically three things that an individual has to be worried about. Number one, they got an annual deductible or a yearly deductible. This year it happens to be $183. And then after that $183 has been satisfied, then an individual has to pay the co-insurance. Generally 20% is what it's going to be. And this is going to be based upon the Medicare approved charges. That's going to be a key phrase. Now, when it comes to Medicare and the medical profession, doctors, hospitals fall into one of two categories with Medicare. Either they agree to the approved charges as payment in full, or they don't. Now, for those that agree to the approved charges as payment in full, from the consumer standpoint, all they have to worry about then is going to be the annual deductible and the 20% co-insurance. However, if the doctor or hospital does not agree to the approved charges payment in full, then the consumer could end up being exposed to what is referred to as an excess charge. And therefore, if the provider doesn't agree to Medicare approved charge, the additional charge could be up to 15% more of whatever the Medicare approved charge may be. An example, let's say the Medicare approved charge was $100. Well, if the yearly deductible has been met, Mr. Jones would have to pay 20% of that $100, which would be $20. Medicare would take care of 80% or $80. But if the doctor did not agree to the approved charges payment in full, there could be an additional $15 charge that our fictitious Mr. Jones would have to pay. So, in a simple example like that, it doesn't seem like a big deal. But if we're talking about a major surgery, $100,000, we can see how quickly those costs can add up for an individual. So when we look at those out-of-pocket costs that an individual could experience under Medicare Part A and Medicare Part B, Medicare Part A and Part B by itself may not be the wisest decision for somebody to make. And that's why Medicare supplemental policies are out there. Now, many of you have knowledge of this, so I don't want to spend a lot of time in connection with this. But Medicare insurance policies sold by insurance companies, they'll fill the gap in original Medicare, so it'll cover that $1,340. It'll cover the $183, the 20%, the excess charges, and the like is what it will do. When's the best time for somebody to buy it? Generally when somebody is eligible right out of the gate with Medicare Part A and Part B. And so they have a guaranteed issue period. So regardless as to what their health may be at the time, let's say they turn 65, in other words, they can have one foot in the grave, the other on the banana peel, surgeon standing overhead with a scalpel. That's the best time to get a Medicare supplemental plan. They can't be turned down, and they can buy it. Now, if they miss that 6-month window, the opportunity for them to get a Medicare supplemental plan policy may be restricted because now they have to qualify based upon health. So they got to go through that underwriting philosophy. Now, we just got done speaking about the left-hand side of the column here. So we talked about Medicare Part A and Part B. We talked about a Medicare supplement. We'll get to Part D in just a moment. But some people may want to exercise their right or option, and they may want to consider what's on the right-hand side. This is Medicare Advantage. Now, David mentioned at the onset that next Monday, June the 18th, begins AHIP. This is where an individual agent can become certified to facilitate somebody's enrollment into this optional program, Medicare Advantage plan. So I'm not going to get too deep into the weeds, so to speak, in connection with everything going on with Part C and Part D. I'm going to let AHIP handle that for you. But just to provide some general knowledge in connection with what Medicare Advantage plans are and how perhaps they may compare and contrast to what's on the left-hand side of our screen here.
Let's go ahead and launch our next poll. Before we get into that Medicare discussion on the Medicare Advantage, let's finish up with this one here. So what year will the Plan F disappear as an option for seniors? Some of you may know this, some of you may not, but this is a pretty important fact that if you don't know it already, you'll need to know, and we'll share the answers at the end of the webinar. But go ahead and finish up your answers on this one. We've got 2022, 2021, 2020, and 2019 are your options. If you would kindly finish up your answers, we'll go ahead and move on with our presentation. Okay, so back into the presentation we go.
All right, very good. So Medicare Advantage plans, how do they work? So they're health plans, they're approved by Medicare, just a different way to get healthcare benefits, still run by Medicare, but private companies are the ones that are administering them. So Humana, Blue Cross Blue Shield, United Healthcare, Aetna, Cigna, there's a number of different insurance companies out there that are participating with the federal government to offer these healthcare plans to those individuals that qualify for Medicare. Now, it's optional. Most people that enroll into these plans, I should say all people that enroll into these plans on an optional mode, Medicare is going to pay the insurance company a set amount for each member's care. So the insurance company is responsible for taking that money and managing the health care of the individual that enrolled into the program. There's distinctive advantages to the program. If we look at it from a product feature standpoint, as we're comparing it with Medicare Part A and Part B, as we've already discussed, Medicare Part A is going to cover you in the event you go into the hospital, you need skilled nursing home health care. It'll cover hospice. It'll cover blood if somebody needs it. Medicare Part B is going to cover the doctor services, and pretty much that's about it. So I'll call it major medical. So it's going to take care of the major issues that may manifest themselves. Well, Medicare Part C is designed to do much the same thing. However, because they're optional, the federal government is giving a little bit extra money to these insurance companies so that they can include some value-added benefits, such as could be dental benefits, vision benefits, hearing benefits, could be gym memberships, transportation, over-the-counter medication. Sometimes a prescription drug plan is included, just to name a few of the extra benefits that could be included into a Part C program, therefore making them look very attractive to individuals, therefore allowing these insurance companies to gain more membership. Now, the downside of the program, if we want to call it that, is that all the doctors and all the hospitals that may participate with Medicare Part A and Part B are not required to participate with Part C. So therefore, there's a network of doctors and hospitals that may pale in comparison to the number of doctors and hospitals that will see you if you have Medicare Part A and Part B. And as mentioned, the types of plans that are available may vary. Once again, you're going to learn everything and then some when you go through your AHIP certification. How do they work? You join the plan. An individual still covered by Medicare. They're going to get those services that are still rendered under Part A and Part B, but the MA plan is going to cover those services instead. Some plans may have a built-in drug plan, some may not, and some are going to have those extra benefits that we have already alluded to. When can an individual enroll into this Medicare Advantage plan? Well, generally during your initial enrollment period. If you can remember back a few slides ago, it's that 7-month window. The month when somebody's eligible for Medicare, 3 months before it and 3 months after. That's the best time where somebody can exercise their right to enroll into a Medicare Advantage plan right out of the gate, so to speak. If they miss that window, the next one happens every year. We really call it, it's called the annual enrollment. I see it says open enrollment period there. Probably should say annual enrollment period. Begins October the 15th through December the 7th. And when a person exercises their right to enroll, benefits are going to begin January the 1st. And for the most part, individuals, once they make their decision, they're going to be locked into their decision for a calendar year. Now, can they join a Medicare Advantage plan at other times during the course of the year? Yeah, but special situations have to be taken into consideration. Once again, you're going to learn everything and then some when it comes to Medicare Advantage plans when you go through your certification. Should an individual enroll into one? Well, there's some minimum requirements. They got to have Medicare Part A and Part B to join. Most Medicare Advantage companies offer comprehensive coverage, including Part D, which makes them attractive. Some plans may require you to use the network. You may need to see in order to see a specialist, you got to get a referral. You still have to pay the Part B monthly plan premium. So it might be $134 a month that they still have to pay. And a person can leave the plan or join the plan only at certain periods during the course of the year. Very important. does not work with a Medicare supplement or MediGap policy. And the bottom line is if somebody's got end-stage renal disease, they're not really eligible for a Medicare Advantage plan.
So let's go ahead and take up our next poll. Some of you may know this, some of you may not, but a great opportunity to learn. What year did AmeriLife start doing business? So those of you who have been doing business with us for a while will know this right out of the gate. But for those of you who are new and don't really know the history of AmeriLife and how long we've been doing business in this marketplace, maybe it's good that you know the answers to this question. I see there's about 60% of the folks have voted. We've got 1983, 1990, 1985, and 1971. So about 70% have voted. So we're going to go ahead and close the poll and move on to our presentation again.
All right, I just want to commend, it looks like some of you have done your homework in regards to who AmeriLife is, so kind of encouraging to see there. The last portion of Medicare of the parts of Medicare is Part D, prescription drug coverage. This is a program that many people are very much interested in. It was instituted back in 2006, available for people who are on the Medicare program. It's provided by the private sector. So insurance companies are the ones that are offering these particular programs. Please keep in mind that the Centers for Medicare and Medicaid Services, they're the ones that are continuing to oversee the program is what they're doing. How does it work? Well, a person chooses to join the plan. They can do so. It's an option. It's an option, but the government wants everybody to be enrolled into these particular programs, and therefore, if somebody changes their mind a little bit later on, there's going to be a penalty that they're going to have to pay. And once again, when you go through your certification, you're going to learn how that's calculated and how to do that yourself. Plans have formularies, list of covered medications. The government has a master formulary list. There's 100 different categories and medications that are assigned to each and every one of those categories. Now, just because the government has the master list doesn't mean that these insurance companies have to adopt that master list 100% of the way. So insurance companies can pick and choose what medications they may choose to cover on their formulary list. There's a plan premium. Now, the national average is sitting at about $35.02 per month is what that is. And so some will pay more, some will pay less, but that's that national average that we're seeing currently. There's deductibles and co-payments. Really, when you look at the basic prescription drug plan, there are 4 phases to the cost sharing. There's generally a deductible, relatively small, just a few $100s per year. And then it enters into 3 different phases of cost sharing. And depending upon how much money an individual pays out of their pocket over the course of a calendar year will determine how quickly they accelerate through those 3 phases of cost sharing. It can be a rather costly program. And we know that a lot of individuals out there are on fixed incomes, and therefore there's extra help that people have access to that will help them to pay for their prescription drug plan. Who can join it? Anybody who has Medicare Part A or Part B, they can join the prescription drug plan. They could also join a Medicare Advantage plan that has a drug benefit associated with it. And so they just have to live in the plan service area. And basically, this is from a geographic standpoint, it's the state. And then a few other requirements that an individual has to meet in order to get the protection that can be afforded to them under a prescription drug plan. When can they enroll? Well, once again, during a 7-month initial enrollment period. And that's when they're first eligible for their Medicare program. If they miss that, they have the open enrollment from October the 15th through December the 7th. And of course, they may be able to join at other times as listed there for you. So once again, this is just a quick breakdown as to what's going on with Medicare Part D. As a side point, what's really going to be beneficial for you as you're trying to assist your customer, your prospect in connection with what drug plan makes the most sense, I would encourage you to become familiar with Medicare.gov. Go to Medicare.gov if you haven't done so. It has a prescription drug plan finder. And all you have to do is become familiar with the website. All you have to do is plug in the medications, and the state's or the government's website will do all the work for you, provide you with a spreadsheet of all the prescription drug plans that are available. It will rank them from the least cost of ownership to the most cost of ownership based upon what's available in your state. So the government has done a good job with that particular website, and it really helps to simplify the process of you helping people kind of go through numerous options. And here in the state of Florida, for example, there's over 20 to 25 different prescription drug plans, and trying to sort through all the materials could be a time-consuming effort. Therefore, Medicare.gov has really simplified things for us. So in closing, what we have here is the key points in which for us to remember, but I guess before we get there, we got another poll, right?
Yeah, let's go ahead and launch another poll while we're here. All right, let's do. So this is something that's a new program with us, and this is kind of my way of kind of trying to figure out if you may have an interest in participating in our pharmacy program. So if you have an interest in participating in our pharmacy program, please go ahead and just select the yes button. If not, then please, by all means, we'll take you off any list that might give you eligibility to participate. But if we have a pharmacy in your area, would you be interested in participating as an agent assigned to that pharmacy? So we're looking for folks that can help us to fill a number of different pharmacies nationwide. So that would be great. It looks like we've got about half the people have jumped in. Many are interested, so that's great. We'll go ahead and close that poll and move on and let James kind of wrap up his presentation here. We've got some more to share with you, so stick with us.
All right. So just some key points to remember. Medicare is nothing more than a health insurance program. That's it. Doesn't cover all of the cost, but there are choices out there, and that's where you come in, helping individuals understand what their rights and their options are. If there's issues with limited income, there's resources for those individuals. And, the bottom line is you need to demonstrate yourself as a resource. Don't leave things to chance. Don't let the book, Medicare and You, provide education. There's a lot of information in there, but it's confusing. The website, we're talking about a senior population that hasn't yet fully embraced technology, so that not many of them go there. They don't like to go to Social Security. They don't like to call the 1-800 numbers. So they're looking for resources that they could go to that are reliable, that's going to provide them with some good guidance and direction. So in closing, as we look at these two programs kind of side by side, you got Medicare Part A and Part B, you got Medicare Part C. How does it really fit? I come from an environment where I always like to put things as to good, better, and best. So what would be the best coverage available for someone? Well, usually you're looking at Medicare Part A and Part B with a Medicare supplemental program associated with that. At least that way we can guarantee, at least presently, that if somebody goes to the doctor or has to go to the hospital, they'll never get a bill if they have the right Medicare supplemental plan in place. Well, some people can't afford the expense associated with that. So that's where Part C comes in. So that could be a better type approach to healthcare coverage. It covers everything that Medicare is supposed to cover, plus some extra benefits, but there is some cost sharing associated with that program, which could get expensive. And then the good program out there is just Medicare Part A and Part B. And that's not really good when you consider the options that are available to people out there. So just a brief review. You need more details. You got a great staff here that's more than happy to help answer those questions for you. And with that being said, I'd like to thank you for giving me a few minutes of your time, and I'm going to turn the meeting back over to David.
Well, that's great. Thank you, James, for helping out with a better understanding of the Medicare program. I'm going to launch another. Poll, and see if we can hide results. This one's just kind of fun. It's sort of an interesting bit of information about the music that we began the webinar with. If you happen to know who that artist was, go ahead and jump in there and answer the question. So it looks like, oh wow, very, very interesting that so far nobody has gotten that one right. So keep on jumping in there. I got 61% of the folks jumping in. I may have given away the answer, but we did have a couple of people jump in and get that one right. The great thing about it is, the main goal for our presentation today was to share some insight on the Medicare program to help you to have a better understanding or even refresh that understanding. But on top of that, I always love to give stuff away on our webinars. And so I brought in a really good friend of mine. He's a guy that has been in the business a long time. His name is Todd Justin. He is one of the owners of a company called Orbis Marketing, and he is our sponsor today. So I thank him for participating and jumping in to pony up about 100 leads. And I didn't know quite what to ask him for, but basically what we're going to do is we're going to give away 100 exclusive leads. And we're going to split it up amongst 10 of the people who answered the most questions correctly. And so each person will get 10 exclusive leads. And I'm going to let Todd jump in and tell you a little bit about the leads and what they actually are, because we found really great results with these leads from those that are using it currently. Todd, you want to tell us a little bit about your product here?
Yes, thank you, David. I appreciate it. Everybody else, appreciate you taking time out of your day. Just wanted to give you a quick overview of what our leads are. They're quite unique from what you'll see outside of the marketplace, but we have an exclusive telemarketed lead. All our leads are delivered within 24 hours, and here's the best part about them. They're extremely detailed. When our marketers are calling out to these people, they're going to find out who their insurance carrier is. They're going to find out how much premium they're paying. They're going to find out government assistance, whether they're tobacco users. And I would say on about 70% of our leads, you're going to get somewhere between 2 and 3 years of health history on these people. We even go as far as instructing our marketers to, if they hear a dog barking in the background, we want the name of the dog. If they have family in town, we want to know where that family's from. Anything to help you, the agent, have more of a connection with that prospect. At the end of every call, our marketers tell the people that an insurance specialist will be giving them a call to go over their cost options. All our leads are specially developed towards you. So we will mention your name on the lead. We will, or on the call, we'll mention the name of the company you're with.
So it's kind of like having your own assistant out generating appointments for you that, when you get to the appointment, you've got enough information to really be in the, let's face it, if you know what they have, what health conditions they've got, whether they smoke or don't smoke, what the name of their dog is, chances are you stand a really high likelihood of being able to, A, get in the door, and B, be wise enough with how to approach that lead and come away with a sale.
Exactly. I mean, I look at our job, David, as we need to tee up that ball. We do all that grunt work that the agent doesn't have time to do, nor do they want to do. So we make all the calls. We find those people that are receptive on the phone, that pick up the phone, and that are going to give us some information on them.
Well, that's fantastic, Todd. So thank you so much for jumping in and offering, what I would consider to be a pretty valuable, lead to our agents. And again, 10 of you are going to get free ones. But I think probably the best part about you coming on, you just told me this before the webinar, but why don't you go ahead and tell them what you mentioned to me just before our call today?
Yeah, I mean, the pricing of our leads are $13 each, And what we're going to do today is, because you spent an hour on this call with David, we're going to offer those leads to you for $10 each. So I just felt that for them to take so much time out of their day to do this, a 30% discount on the leads is well worth it.
Yeah, I think that's fantastic, and thank you so much for jumping in and offering even more value. So, folks, thank you so much for coming out and joining us today. I want to reiterate a couple of points. We've got the AHIP certification being released on Monday the 18th, so be sure to get your certification in early. That way you can be seen as ready to sell where it comes to Medicare Advantage plans. Also, if you are interested in participating in our reimbursement program, by all means, ask your marketer about how that works and how you too can participate in that reimbursement program. Ask your marketers about of course, we just talked about the lead giveaway. Poll participation is how we're going to, determine who gets the freebies. But you'll all get a discount on the purchases if you are interested in purchasing leads through Orbis Marketing and Todd Justin. Also, ask your marketer about the direct mail lead program. We offer marketing assistance to our agents who do business with us after they've written a 10th piece of business. And again, I know many of the marketing organizations out there in America do not do this, but we extend that 10 pieces of business all the way back 12 calendar months. So if over a 12-month period you were able to write those 10 pieces of business, you will then be eligible to get that $420 worth of marketing credits that, really we're going to give you a 1,000-piece mailer for absolutely nothing. Some agents do it in a month. Some agents do it in a week. Some agents do it over the course of a year because they're just not, selling that much. But nonetheless, the money is there for you. There is no resetting of the, the calculation period. So we're trying to make it as easy as we can for you to be good business partners and make sure that you're able to continually, have that marketing assistance from our organization. We want to be a great business partner and offer more and more value every day to the people we do business with. And speaking of more value, the poll that asked about the pharmacy program, I did get an email while we were on this webinar, and we've got the details related to this pharmacy program. I'm going to be sharing that in detail through LinkedIn. So be sure to check into the LinkedIn to see the details on that so we can get you set up as quickly as possible. I know we've got a lot of very valuable locations in both the CVS pharmacies throughout America and Walmarts. So these are high traffic areas where we've seen agents write 200 to 400 applications during the annual enrollment period. So this could be a very, very lucrative opportunity for you. And we love the opportunity of giving our agents the chance to participate. So reach out to your marketer right away. Get in on this the moment that you think you're interested. Get in touch with somebody in this organization that you're familiar with. If you're not familiar with anybody, just call the office and ask for details about the pharmacy program, and our centrally located receptionist will then direct you to a new marketer that you can build a relationship with. So again, I am thrilled that you guys took the time out of your day to join us. My name is David Paul. I'm the host of our webinar series here at the AmeriLife Marketing Group, and I appreciate you taking the time out of your day to join us. With that, I will let you get back on with your day, and I hope you do well out there. Take care, everybody. Have a good day.